Hello everyone. I have one good news for my friends here. Do you want to know?
Yeah.
Women advisor.
I'm the last person in the line of speakers.
No, we enjoy.
So you, and I promise I won't take much of your time. Thank you so much for coming. And I have, another question for you. So they call, when they remove your tonsils, they call it tonsillectomy. When they remove appendix, they call it appendectomy. What do they call it when they remove a growth from your head? The gentleman in the orange shirt. Huh?
A brain problem.
Very good answer, very good guess. A haircut. Thank you, Shubhangi, for your kind words. Talking about appendix and tonsils, the topic of my talk is overdiagnosis. I have divided my talk in 4 parts. What is overdiagnosis? The mechanisms through which it is happening, the evidence in the population, the impact of overdiagnosis, and reasons behind it. So last week I was talking to one of my friends, and she got injured. She got one of her finger injured, and she went to see her doctor. The doctor said, well, though it looks like a minor paper cut, but you see, we have to run a bunch of tests just to make sure. So it is the medical society we live in. The conventional wisdom is that early diagnosis, particularly more early diagnosis, leads to better medical care. The logic goes something like this. More diagnosis leads to more treatment leads to better health care. Well, this may be true for some, but there is another side to the story. More diagnosis can lead to excessive treatment for the conditions that are not that bothersome or not bothersome at all. Therefore, excessive treatment, of course, can really hurt you. Overdiagnosis is a side effect of screening for early forms of disease. The conundrum is that the clinicians can never know who is overdiagnosed at the time of diagnosis. Let's see some of the mechanisms through which it is happening. Clinicians are able to see more. Earlier, through X-rays, they were able to see a tumor of 10 centimeter of size. But today, with high-resolution CT scans, they're able to see a tumor as small as 1 centimeter in size. They're looking harder for the problems. They're doing a lot more cross-sectional imaging. They stumble upon things. They do X-ray for one condition, and then they stumble upon something else, and then they think they have to do something about it to treat it. They gave it a term, incidentalomas. It's kind of funny. The fact is that if they really look hard, they will be able to see or find some kind of abnormality in each of our body organs. The evidence that overdiagnoses are happening in the populations are many. The one I will be discussing about is cancer. The heterogeneity of cancer is such that some cancers don't progress at all. And there are various reasons, such as some outgrow their blood supply and therefore they are starved. Some are recognized by the host immune system and therefore they are contained. And some are not aggressive in the first place. While they cannot benefit at all, overdiagnosed patients can be grievously harmed by cancer treatments. So now we have this question: is it possible to precisely quantify the harms and benefits of screening? Well, it's a tricky question, and I'm going to present you with some data and leave it up to you to decide for yourself. among 2,500 women age 50 undergoing annual mammography for 10-year period of time, 1 to 2 will avoid to have a death. About 1,000 of those will have at least one false positive. Half of those will undergo a biopsy, and 10 to 20 will be overdiagnosed and treated unnecessarily. This is worse for the prostate cancer cases. For every one person who is avoided to have death, there are at least 50 people who are overdiagnosed and treated unnecessarily. Overdiagnosis is happening a lot in cervical cancer cases, leading to various treatments such as freezing and laser therapy. And that may cause a lot of side effects such as fertility problems and later makes pregnancy impossible. So there is a shift in the paradigm. The old paradigm was make diagnosis in people who are experiencing problem. The new paradigm is seek diagnosis in people who are not experiencing any problems. So now the question is, should we stop improving our diagnostic techniques? Or does this mean that we should abandon general screening? Any thoughts? Yes, gentleman in the blue shirt.
Thanks. Sometime back you used to call me young gentleman.
Okay.
So,
My bad.
yeah, I think
Young
we should
gentleman.
not stop, and I can identify with one thing. I just gave my snowblower for service, and the overdiagnosis was that I needed a change of carburetor, and I needed some bracket that would help me put it back into reverse gear. And I just went there for a $40 change of thread that you use for pulling the snowblower, and now the estimate is $300. And I still don't know if it is free of cancer.
You can get a new one in
I
300.
feel bad for
I
our
mean, this is a big one.
Okay.
snowblower. Thank you for your input. So, while I'm not saying the paradigm of early diagnosis is always wrong, it's always better to see patients early in their course of pneumonia than to wait until they develop sepsis. It's always better to see patients early in their course of heart attack than to wait until they develop arrhythmias. But the current reality is not that. The current reality is do early diagnosis and seek a bunch of patients. And the future of these patients are going to be a little more complicated. While some of those are destined to develop problems, although not necessarily, but at the same time, now we got a bunch of people who are not destined to develop any problems. And it is this group of people who are going to be overdiagnosed and treated unnecessarily. It is this, nothing good can happen to this group. They will face the impact of overdiagnosis in terms of subsequent appointments, medication side effects, surgical complications, and even death. The impact of overdiagnosis can be tremendous. It affects a patient's sense of well-being, their ability to get medical insurance, and even their life expectancy. So now when we know that it is prevalent in our society, current society, any thoughts about what are the driving forces behind overdiagnosis or screening? Yes, gentleman in the blue shirt.
Lawsuits.
The gentleman, thank you for your input. The gentleman in the blue shirt said lawsuits, which is absolutely right. So the two main, there are various reasons, but patient demands, the influence of pharmaceutical and device industry, and the lawsuits are main reasons behind it. There is a lot of the physician, the clinician will be penalized heavily if they miss something, but there is no penalty for ordering too many tests. So far I talked about what is overdiagnosis, the mechanisms through which it is happening in the society, evidence the reasons behind it, and the impact. To conclude my talk, I would like to draw your attention to two main aspects: health promotion and early diagnosis. Health promotion is what your grandma might have told you. Eat your fruits and vegetables, don't smoke. No one is identifying a problem here, nothing being alert about. The basic idea is stay positive and stay healthy. The basic idea for early diagnosis is to look hard for the problems. Today, with improved diagnostic technology, if doctors don't use them, patients use them for either misdiagnosis or delayed diagnosis. So the simple question may be, what amount of excessive cost and morbidity is it worth to save a human life? Thank you.
Awesome.